to do what you are saying, it requires a certain transformation of habits, right? So if I'm a housekeeping person, I normally don't record whatever is being done. If I'm a nurse, I don't record it. If I'm somebody else, I don't record it. So clearly, uh, what I know of your system is it's probably the most complicated, match that you do with all the data that you get, right? So somewhere I was talking to somebody, and that they said, you almost do a HL type match with the blood that comes in, and that's the kind of sophistication you have built with ML AI in your systems and things like that. But let me first go back and then say, to get this data, there's a certain amount of habit change that's required. Okay, and that habit change then has to be simple enough for me to capture this data for giving insights. So how do you kind of do that? And it's such a difficult change that you are actually pursuing, right?
Let me tell you a story about one of our customers. So if one had to put all the hospitals in the country ranked as per the number of errors they make in a procedure, probably this hospital would be the worst. Because they record more than 1000 errors a year in their clinical facility. The interesting thing is, more than 90% of these errors are self-reported. So this is not somebody else identifying and reporting. So how do we bring about this change? First change is make things easy for the person to do. So we never have a situation where somebody would be asked to duplicate things, copy from one screen to the other. I'll give you a simple example. If a lab report is out and the values are there, then there should be no need for somebody to copy them on a piece of paper and organize them for somebody else to be able to see. But that's how things are happening in our situation. So what we do is we provide contextual personas. The nurse gets the screen the way she likes it. The same data is available to the next person the way they like it, the pharmacist the way they like it, the doctor the way they like it, and the housekeeping the way they enjoy it. In fact, we had one of our centers where a housekeeping person had the highest compliance to checklists. And he enjoyed it because it was the first time that really his ticking of that sheet was making a difference. You go to any of our toilets, any washrooms, you find those sheets stuck up there. Who cares and who bothers? But this person knows that it matters. So how this helps is, so number one, you empower people and you make things very contextualized to them. Second thing is, you make it a little more difficult for them to make mistakes by giving them just-in-time feedback, by giving them alerts, by giving them messages. So somebody puts in a value which doesn't make sense. Either you can bring it up at the time of clinical review, or you can let the person know, are you sure you want to do this? It seems unlikely that this is the case. So when you put just-in-time feedback for user actions, then your data quality is automatically improved. And the person is automatically engaged because now he knows this is not just another place to document things. This is helping me do my work better. So we use a lot of alerts. We use a lot of highlighting, very subtle things, on-screen things, which help people make sure that whatever they are putting in is more meaningful, more contextual. We help them plan their work, schedule their work. This is one of the most difficult things in a situation like a hospital. There are 5 patients, 3 monitors are beeping, 20 instructions are there for next 2 hours. For the system, if all the data is available, it is very easy to really put out a priority list. Not really to judge the person and instruct them, but to give them a view that these are the possible things that you might want to look at first and then move to the others. So you realize that first of all, you have to get the system to talk to its user in a way that both of them are enjoying. So one of the biggest joy I have is that most people who see our system for the first time fall in love with it, especially the nurses, especially the ones who are whose voice is never heard. And this is because then they are part of the game. The second thing is that we encourage, of course, it goes without saying that in a critical situation, transparency is what will definitely help improve outcomes. A computer system becomes a policing system if the management takes the approach to penalize. And this is one of the major organizational changes which comes when people take the digitization journey. We actually engage in comprehensive program management for our customers. You can't just take a software system, give it to an organization which was working on a completely different manner, and expect those subtle human realities to change by themselves. So we undertake a process going into several months where all these roles understand these subtle things to keep in mind when things are going to suddenly become so transparent, when all the data is suddenly going to become so available. And one of the very crucial changes we encourage is non-punitive approach, especially when people come up by themselves to report problems. A good designed system will help you discover errors. If you can encourage your users to the degree that they feel protected enough to say, my God, I made this mistake. I don't know whether I can fix it on my own, but I want everybody in the team to know so that at least the further damage control can be done. So incident reporting for this customer worked so well that I started with that they are filing 1,000 reports. And this is all people filing by themselves, meeting every week, discussing what went wrong. Now it changes from blame to careful scrutiny of the process. And that's where you come across those very beautiful, subtle issues within the system that are preventing people from doing what they should be doing, that are coming in the way of proper healthcare delivery. When conversation moves to that level, you have people who are engaged to the degree that they start receiving joy in saying that, no, I make mistakes, but I also fix them. And I am involved in keeping our patients safer. We were very fortunate that several of our customers have actually undergone this transformation to the degree that now entering data is never a push. They don't like it any other way. Just to share one very important thing. We don't have a concept of data managers with BMTPLUS. Our most complicated program, which is taking care of tertiary care, wherever it gets installed, we never really suggest that data managers are brought in. And the fundamental thing is, if the primary user is not benefiting from what the system is doing immediately, then probably everything is for the sake of reports. I can't even think of one of our users who's actually using a data manager to key in all the information that we receive.